Okay, so basically, I'm now going to start on longevity. So basically, longevity meaning that actually you are able to live a long life. Okay, who want to live a long life? Can I see your hand? Wow, most of you who are come want to have a long life, right? So maybe I would like to ask you, why you want to live long? Huh? Pardon? Correct, correct. Nowadays, they call health span. Rather than lifespan, it's like health span. Okay, so you need to live long and be healthy. Anyone have any answer why you want to live long? Enjoy food longer. Ah? Okay, okay. Yes? Yes, I actually heard this answer a lot of time. Yeah, most of the grandparents, they want to see the grandchildren to grow up. So that's why to practice more, yeah. So you can see that, yeah. So that's why just now they say the meaning, purpose of life. So why you want to live long, or what the purpose in life actually is very important. And now okay. So basically in our world in data, actually you can select the country you want to see, and they actually come out this graph. Okay, I just select a few countries. So you can see the currently in 2021. Okay, for the top, I mean, for those who actually live more than 80-year-old, you can see Japan, Australia, Singapore, although I think there are some more countries live above that, but I just select a few which are related to us. So you can see they actually live very long, okay? And we in the beginning itself, we can see that this basically only two countries that I selected, they have data in 1920. And the other country, they actually have started data only on 1940. Okay, so we can see this orange color basically is Australian. Okay, in the beginning itself, Australia actually live longer. And then the purple color is the United States. Okay, so but however, you can see the United States have come down, the ranking. Okay, but obviously we can know that the developed country, okay, they actually live longer. Why? Because one thing is their this medical how do you say, access is very easy available. Okay, so actually I'm from Johor Bahru, just next to Singapore. So whoever I know who are quite wealthy, have money, most of them, if they get cancer, they will go Singapore to treat. Okay, and I also have some health guests. Actually, I work in a health center. Some of the cancer patients also will come and share to me why they choose Singapore. Because they say, oh, the service is very good. If you go to Malaysia Cancer Center, you wait until don't know what time, the doctor haven't come. Okay, but when you go Singapore, you go there straight away, do blood test straight away, see doctor, no need to waste time. Okay, very systematic. So yeah, actually medical is very good. And then the Singapore customer share with me, the government give them all this, okay, band watch, everyone have, okay, free. If you want to get, you can take. And then what they do is, if you reach 10,000 steps, you will get a voucher, okay, that you can shopping and buy things. Okay, so the government really do a lot of things that want to appreciate, okay, because the government is smart. They know that if the people don't take care of themselves, the government is going to pay a lot of money for medical expenses. Okay, so that's why currently in Singapore, number one killer is no longer heart disease, because they already wipe off all the risk factor. Hypertension, they already reduce the prevalence of hypertension, diabetic. Okay, but now number one is cancer. Yeah, so there's a lot of people in Singapore that have cancer. Okay, possible is due to stress, because if you actually four of my sister live in Singapore, so they always complain, a little bit challenge to work in Singapore because actually stress level is higher. Okay, and we also see, obviously now we are going to learn from Japan, the number one. Okay, since beginning until now, everyone in Japan live very long. Okay, and we can also see Malaysia, Philippines, Indonesia, India. We are still developed country, so our Malaysian is the average lifespan will be around 70-year-old, and Philippines, Indonesia is above 65-year-old. Okay. So now we want to learn from Okinawans. Okay, what is the secret? And so they have said a living, okay, a reason of being, why you want to live. Okay, so this mentality is called ikigai. Okay, ikigai. So how do you know what is your ikigai? What is the meaning or purpose of living? You can answer these 4 questions. What you are good at, what you love, what the world needs, and what you can be paid for. Okay, so this means if you every day when you work is very miserable, okay, and then you feel like you don't want to actually do the career. Actually, this career maybe is not suitable for you, okay, because you need to work with your passion. Then your work is better. Just like me, last time I work in the hospital, I feel so down. Okay, every day I have to on call, every day I have to cannot sleep well, and then the emotional also very bad, become very angry easily because you didn't sleep well. Okay. And the environment, everyone is shouting each other. So I also used to shout at people as well. Okay, but however, later we see. And that's why it's important that I actually change my career to lifestyle medicine. I'm very happy also. I'm very happy to talk to you because I think that I might make some impact in your life. Okay, if you're willing to change. So that's why I feel, because I have few help guests under my care. So every time they come, I listen to their story. Oh, I change. I do exercise. Okay, and then I also keep on eyes on my diet, and the cholesterol drop, and the weight drop, and fatty liver disappear. So that's why it's very amazing. The medication cannot do this kind of thing, but if you be able to change your lifestyle, it will do a miracle. It's not actually a miracle. It's actually our body supposed to be like that. But just like sometimes we have done, we didn't live according to the nature law, that we actually abuse our body. So that's why we have the chronic diseases. Obviously, it's not applied to all diseases, but most of the chronic diseases is due to the improper lifestyle. Okay. So that's why hopefully everyone will know why you want to live. Okay. So for me, my passion is to share how to live longer. Okay. How to have a good lifestyle to everyone so that everyone can be healthy. Okay. And they also rely on a plant-based diet. So I'm not sure this is very clear or not, but anyway, you can see their diet, 67% they eat sweet potato. Okay. Obviously, I don't ask you eat sweet potato every day because we need to have rainbow color. But why it's good? Because it's very high in fiber. Okay, and they are very rich in mineral. And the red color sweet potato, they're rich in vitamin A also. So that's why there are many antioxidants in the sweet potato. So that's why if you want to eat carbohydrate, nowadays a lot of people tell me I don't want to eat carbo, I scared become fat. So that's why a lot of ladies, when they actually want to lose weight, they become miserable. Okay, because they do not have enough vitamin B and do not have enough nutrient. Okay, because they don't eat carbo. So that's why it's very important to choose to eat carbo. Actually, we need carbohydrate because they're source of energy and source of happiness also. Okay, but however, we need to choose the correct carbohydrate. Okay, which is the whole food plant-based carbohydrate. Okay, complex carbohydrate rather than the white rice, kway teow, bihun. I know that tastes very good, but however, it's not so healthy. Okay, because they do not provide us the so much nutrient. Most of them have been withdrawn. Okay, so nowadays actually there's some substitute. Okay, whole wheat noodles. Okay, or brown rice, bihun. Okay, there's substitution. Obviously, it's not the best, but we can actually use that. And the other one, they also you can also see they took a lot of vegetable, legume, beans, which is most of the time is the soy, okay, product. And last two talk, we already talk about soy. And they are took minimal fish, meat, poultry, and other foods, okay. And we can also see they actually like to eat goya, which is bitter melon. And you can see this is this kind of bitter melon. So in my center in England Healthcare, we use this to help the patient to control their blood sugar. Okay, so I think 75 ml, okay, a small cup of bitter melon is equal to 500 mg of metformin. Okay, but that is natural. Okay, so the bitter gourd actually really can help you to reduce your blood sugar. Okay, but obviously not. Okay, Dr. Pua say bitter gourd very good. I don't take medicine, I take bitter gourd. Okay, it's not the way. Okay, you can only reduce your medication once your sugar become normal. Okay, so that's why we need to use natural remedy, but need to monitor also. Okay, more scientifically. Okay, don't just simply stop medication. Very dangerous. Okay, and then and also why bitter gourd is good because it's anti-inflammatory, very high in they have an they actually help the cell to take out the sugar better. And they also have this all this also anti oxidant and so on now. Okay, and they also plant their own food. Actually, gardening is very good because that is one of the physical activity. And then you can eat what you grow. Last time during MCO, okay, because cannot go out. So I started to plant vegetables. So I feel so happy because it's organic. And then I just throw the seed and it will grow. And anytime I want to eat, I just pluck. So no wastage of vegetable, because sometimes I buy too many vegetable and then it got rotten. Okay, so that's why it's very good if you're able to plant your own food. And they also plant some of the herbs. Okay, mugwort is one of the Japanese herb they use for everything, flu, body pain, anything, all the inflammation they can actually use. And ginger, okay, or ginger, for me, I actually use, because sometimes Chinese, they always say, oh, I eat vegetable, become very cold, very liang. Then I say, oh, it's okay. You can cut the ginger and put inside and cook together. Then it will not, because Chinese believe that the ginger is heaty. Okay, so it can balance out. But actually, ginger is very good for bloating also, and also as an anti-vomiting. Okay, my sister actually have this motion sickness. Every time she sit in the car, then she will feel like vomit. Then actually she found out there's a ginger, okay, the anti-emetic made from ginger. So actually now she's taking that, and she's all right with the ginger tablet. And turmeric is also very good, okay, especially they have an anti-cancer property. It can actually slow down the tumor growth, but it also have an anti-platelet. So meaning that if you are taking turmeric, if you need to do any procedure or tooth extraction, you actually need to stop for a week so that it will not increase the bleeding. Okay, another form of supplement is called curcumin. Basically, it extract from the turmeric. Okay, and let's say if you want to cook the turmeric tea from the real turmeric, or use the turmeric powder, we need to put some of the black pepper. Okay, because when you put a little bit black pepper, it can increase the absorption 100%. Okay, so that's why if you want to use turmeric powder or turmeric, the real turmeric, you need to put some this black pepper. Normally we actually cut like a 1 or 2 thumb size this turmeric, or you can use 1 teaspoon of turmeric powder. Okay, and they enjoy the sunshine. Vitamin D is very good for the body, especially for osteoporosis, right? It can help to absorb the calcium, and it also can help to increase the immune system. And they actually try to, and because vitamin D is very important for the hormone synthesis as well. Okay, so vitamin D is very important in our body. So that's why we need to get the sunshine. Okay, 10 to 15 minutes every day is adequate for us already. Okay, and stay active. Okay, if you have any Japanese friend now, when you see them, what you do like this, right? Okay, for me, maybe I cannot bend so much, but anyway, but anyhow, all this kind of is one kind of physical activity. And they also like to sit on tatami. So every time they have to stand up and get up. Okay, and they are very hardworking. Especially, I haven't been to Japan, but it looks like it's very clean everywhere. And everyone actually have a very good attitude. I really appreciate the Japanese attitude. They have a hardship temper attitude, and everyone need to be perfect. Okay, so that's why the hardship temper attitude is very important, because actually currently I feel that, like, if compared to my mother or my grandparents' generation, they actually can cope much more stress and also physical stress as well. But however, when the generation become younger and younger, some people actually label the 20th century born children as what? Strawberry generation. Why? Because when you squeeze and it's smashed already. So a lot of people, they keep changing job. Like these young people, they cannot cope with stress. So they keep changing job. But not everyone like this. Okay, but however, if we really can have hardship, everyone, all the boss will be very happy, right? If you have a very hardship temper attitude, okay, if you have a worker like that, you'll be very happy. And obviously, they actually have a very good social support group, which is called Moai. Okay, so basically, it's wherever they live. Okay, they have a actually village support group. Okay, if you have money problem, you have any emotional problem, everyone will sit down together, and then they'll settle the problem. They will chit chat together. So that's why social support is very important. Okay, so after been talking so many points, which one you guess is the most important one to let you live long? Pardon? Plant-based diet, okay. Money, and then what else? Stay active. Huh? Sociable, okay. Now we want to see which one is more important also. Okay, actually, yeah. So, okay, now we want to see who is the oldest people that in the world. Currently, the oldest person is actually from America. The citizenship is America. Yeah, 160 years old. Her name is Maria. So what we now, and then you can see all is ladies. Basically, generally ladies stay longer than men. There's only one man, okay, from South America, Joan Vincent, actually live more than, I mean, on the top 10 list, okay. So now we want to see what is the key word. Can somebody help me to read? Stay away from toxic people. Okay, so just now whoever say the social relationship, okay, congratulations, but no prize for you lah. Okay, so that's why it's very important to stay away from toxic people. So social relationship is very important. Okay, can you imagine? Actually, everyone very surprised. Actually, I'm very agree with this. You know why? Because every time when someone come to tell me my health gas, I tell them, oh, do you have any pain? Yeah, my shoulder very painful. And then I say, you have gastric? Yeah, I have gastric. Oh, I bloated also. Okay, and I say you can sleep well. I cannot sleep well also. Then finally I ask, do you have any stress or any problem? Then they say, ayo, my boss every time demanding me or ayo, my husband every time demanding me, or maybe there's some family problem. The children don't listen to me. You know, all this actually is kind of toxic people Okay. So how can only stay away or how? But cannot, right? Every day you stay together. What to do? Okay. So basically, actually, I heard some people say, if you want to change people, what do you do? Correct. Everyone know, right? But do we practice it? This is another thing, really. So actually, the world is like a mirror. Okay, how you treat other people, how people treat you. So basically, last time, okay, I continue the story. When I work in the hospital, I always shout at people, right? Because people shout at me, I should shout at them. So actually now I changed to work in Aiden Healthcare. Okay. They are, I mean, basically all of us is Christian, so it's different environment. So when I work there, I shout at people. I feel, oh no, why I shout at people? Because no one shout, you know, then I feel so awkward. Okay. So that's why I also started to realize this is my problem. Okay, I should not get angry. Because no one get angry there. Because I think most of them really work quite a long time. So they all have a same character. So that's why actually we can have our own blue zone also. If you are willing to change and you try to influence other people. And they have the importance of maintaining order, tranquility. My English not good, but actually it's a calm, okay, stable, strong connection with family and friends. So that's why if you are calm, okay, you don't get angry so easily, and you talk very meek and very quiet and very soft. Most of people actually they will talk soft to you. Okay, if you start talking very loud to other people, they become even louder. Okay, although you are not angry, but if you talk very loud, it sounds like you're angry. Okay, so that's why if you don't want to meet toxic people, we don't want to become toxic people first, then we all can help each other. Okay. And so that's why we can actually have the emotional stability. Okay, when we actually talk nicely to each other, okay, our mood will be better. And another way, let's say, okay, what I do last time when I want to change, don't want to be angry. First thing I run away. Okay, so let's say if I see these people, I angry with them. I run first. Okay, and then what I do is to admire the nature. Why? Because the nature actually really can calm your mind. Okay, nowadays, just now the videos will say about mindfulness. Okay, because mindfulness, we concentrate on the nature. We don't think too much, okay, on other things. And then our mind, our body actually will calm down. Okay, or you can do breathing exercise. Okay, why breathing exercise is good? Because when we hold our breath or we expel the breath on a longer period, it's going to slow down our heart rate. This is normal, natural, physiological changes. So when we take the breath, the heart rate will increase. When we breathe out slowly, it will calm our mind and it will reduce the heartbeat. So we can become calm down as well. So that's why now a lot of people, they actually, how do you say, they practice breathing exercise. Okay, you count 4, okay, to breathe in, and then you hold for 7 count, and then you breathe out, count 8. Okay, so you can do a few times until you yourself become calm down. Sometimes I cannot sleep, I also practice this as well. Okay, so they can let us to be calm down. Okay, and obviously need to be no worry, no regrets, lots of positivity. Okay, a lot of people, they share with me what they regret. Is didn't spend time with, especially the parents. Okay, like some healthcare will tell me, oh, I really regret I spent so much time to work and earn money, but I didn't have time with my father. But suddenly he got cancer and then he died off already. So that's why actually I also try, okay, not to regret. So whenever I have time, I will try to complete my parents' wish. Okay, wherever they want to go, I bring them and try to spend time with parents. Because really, if in as in I mean, it's the best not to have regret, because sometimes this regret actually will bring trauma to the person when you lost a loved one. Okay, very hard to come out from that incident. This is called a traumatic event or grief process. So that's why it's very important. Okay, get the opportunity, no regret. Anything you want to do, anything you want to accomplish, you don't wait. Okay, complete it immediately if possible. Okay, and then the staying for toxic people. So we don't become toxic. No one will toxic us as well now. So we go to the next one. Okay, and this is the number 2, I mean the second rank, but however, she just actually passed away at the end of February. Okay, so they say being content with what you have. Okay, being content is very important, so that we will not like chasing on money or chasing on a car or chasing on a house. Okay, you'll be content what you have, and you being blessed to live a life of happiness. I think happiness is very important. So that if you live long but you don't happy, no point. Okay, you live long, need to be happy. And the most entertaining to mind your own business. Okay, this is very important for the parents. Okay, because I'm also a child. Okay, so every time my parents want to control me, oh, very miserable. And then the parents also very miserable. So sometimes, actually one time I told the health guest, maybe you should actually let go and let your children choose what they want to do, because they already adult, they will be responsible for about their choice, right? And then you know what the health guest tell me? Yeah, you don't have children, obviously you don't know what I think. But I think that's not true. As scientific already tell us I mean, most of the time, actually, we should not control our children. I think Western country, they have a better system, right? After 18 years, okay, you can just mind your, I mean, they have to do everything by themselves. Yeah, mind your own business, basically. Okay, but I think this is not good in Asian culture. I think the parents do control everything, want to in charge everything. You know, one time, I heard one health guest, they say my children have sickness, okay, because drinking alcohol, and then got high sugar level. And then it seems like they say that, oh, so he actually, the lady is already maybe around 25, 24 in the college. And then they actually bring her out from college and then keep her in the house, don't let her study. I think this is really a bit too much. Okay, so that's why we cannot be too control on our children or other people. Okay, try to control ourselves, mind our own business. Okay, and then and obviously just now we saw about Western country. Now we want to see about the Chinese population in Asia. Okay, so this study is having been conducted in 2002 to 2019. Okay, they follow up 28,563 subjects. They found that they want to see how is the socializing that actually can improve the longevity. Also, they found that for those who actually every day have a good social relationship, they can delay the death by 204%, okay, significantly. So you will see this bar chart. So basically, the first 5 years when they actually do the follow-up, okay, this is the death rate per 100 people. So those who never have any socialization, they actually more people die, okay, on just within the 5 years. But however, after 5 years, you can see the change is not much. It's almost the same. Only the everyday have social relationship, the death rate reduced. So that's why it's very important to have a good social relationship. And this is another one, okay? So is to see, okay? How can we, what is the factor that we can prevent, okay, premature death or mortality, okay? So you can see, the social relationship, the bar, okay, the longer the bar is, meaning that it can delay the dying, okay, mortality, the highest. So you can see actually social relationships is far more important than stop smoking, okay? It's not like you don't stop smoking, but social relationships is much more important compared to stop smoking or anything you do. Okay, so let's say if you exercise, you eat good diet, but you don't have a good social relationship, I mean, it's also is helpful for you, but not so, I mean, but if you actually have a good social relationship, it can bring much more benefit to your health. Okay, because a lot of us actually, we don't realize that. So why I mean, social relationship is so important, because a lot of time you heard people say, oh, you need to exercise, you need to control your diet, but I've never heard people say that, oh, you need to have a good social relationship. Okay, and then we can see also drinking alcohol, stop drinking alcohol or don't drink so much also will help. All the vaccination, so we can see last time why there's suddenly increase in the age is also because of vaccine. And obviously maybe because of the World War, okay, more people died during that time as well. And we can see about exercise, physical activity, BMI, okay, medication to control the hypertension, air pollution, okay. All this actually can help you to reduce the mortality, but the highest is social relationship. So we need to understand about this. And what is the benefit of social connection? It can increase longevity by 15%, and it can give you stronger gene expression for immunity. So you will not so easily to get sick, okay? And you will have a lower rate of anxiety and depression. Obviously, if you have someone to talk to, someone to share about what is your problem, you are very easily to have a calm, okay? Very calm and very easily to relieve your emotional. So you will not have all this anxiety and depression, especially lady, I think we need someone to talk to, okay? And you will very high self-esteem and empathy. I think this is very important for the adolescent, okay, and also the children. So let's say if they actually have they actually grow up with from a very loving family, the character is very different from those who actually have a broken family. And broken family and those who have actually childhood adverse event, they have much more chances of obesity, okay, or depression or other diseases, okay, if they do not have a good social relationship when they are young. And a lot of them will be low self-esteem as well, okay. And low self-esteem is connected with negative thinking. A lot of time they will actually think they are not worthy, okay, they are very bad, and so that they are very low self-esteem and cannot perform well in their study or in the job, okay. And then you can have a better emotion and regulation skill. And social connection is a positive feedback loop, okay. So when you improve your social skill or social connection, you'll be better in emotional and better in physical well-being as well. And because of better emotion, better physical, you're able to social more as well. So it's a positive feedback loop. And what's the danger of low social connection? Just now we saw already is you can actually have a worse health than smoking, high blood pressure, or obesity. Okay, why? Because it will increase the inflammation in the cell because of the stress, okay, the loneliness. It actually will cause inflammation in the body, and higher chance of anxiety and depression, and slow recovery from disease. Can you imagine, you're staying alone and no one take care of you, no one give you food, no one care for you. The person also very hard to recover. Yeah, but however, if a person, every time your mom give you food and then give you drink and whatever, then you recover very fast. Okay, so that's why we actually need all this support from people. And they will increase antisocial behavior and violence, and also the suicide rate. So that's why it's not good to be alone. Especially what, okay, during the COVID time, right? Actually, we are isolated for almost 2 years. So when I just come out from COVID, I'm not sure most of you experience this or not. Actually, I become anti-social. When I see people, I was so scared. Okay, ask me to talk, I also feel like very hard. Okay, very anti-social mode. So that's why isolation for a longer period, you actually have this problem. I'm sorry, I prepared this one for other talk, so I just skip the Bibles very fast. I didn't remove that. Sorry about this. Okay, the character of social connectedness. Okay, so let's say if you this one is to see whether you have all this or not. If you have all this, meaning you are very good in the social connection. Okay, so basically the person should have a different kind of social relationship, like with your friends, okay, your family member, okay, and then maybe you also have a very meaningful and regular social exchange. I think some of you are from Tzu Chi, right? And some of you is from like support group. I think that's very good because you are doing a volunteer service to other people, and then you feel belonging also, okay? And that's why it's very, and the sense of support is very important. and feeling loved, cared for, will value and appreciated by others, and have a close bond with others. So, and you should actually have more than one person to turn to support, included emotion support. Let's say if you have any emotional depression or whatever, or feeling sad or happy, that you are actually able to go to someone that you can talk to. And physical support, let's say if you are sick, okay, someone can actually bring you to see the doctor or maybe help you to buy things, okay? And access to safe public area together, okay, such as park and recreation center, okay, so that you can do exercise together, because sometimes if you exercise alone, it's not sustainable. So there's a lot of like golf club, okay, hiking club, okay, swimming club, or any kind of activity you like that you can join. Okay, so that's why you can join the club or groups, okay, because the like-minded people, they are more easily to connect together, okay, and they can form new connections. So that's why it's good to find out the people who you like to, that you can actually mingle around with them, and try to do some volunteer service. Okay, like me, I like to do some medical missionary trip, okay, because actually it's quite interesting. You can go to the village and stay with them. Yeah, especially when I went to Sarawak. Okay, we have medical missionary trip. We do free health screening, and the dentist also came with us. They do a free dental check, and we are able to experience to stay in the long house, because it's not easy if you want to stay in a long house, and it's really good experience. And you can eat all the wild plant, okay, jungle food. Obviously, I'm not aiming for that, but it's a, how do you say, it's a benefit when you actually try to serve other people, okay? And also you can stay in touch with your old friend, or can try to be open to forming new connection. Last time, because my how to say, occupation is a doctor, so sometimes I don't like to give people my phone number, because I feel later they all contact me, I'm very busy, I cannot talk. But now I change my mindset. I feel that actually I give my number is also beneficial for me, because we can make a new connection, and then we can actually help each other. Because I also learn a lot of things from my health guests, because they are from different how do you say, occupation. So some of them tell me, oh, actually some of them are consultant. Okay, they consult the company how to do business. And so I learned the management skill from them as well. And then some of them maybe is doing agriculture. Okay, I also learned some agriculture skill. So that's why when we actually serve other people, when we mingle with other people, we'll get more knowledge and more happiness as well. Okay, so basically now we are going to see the Malaysia. How about Malaysia? What is the average lifespan? Okay, so for male is 72.5-year-old, for female is 77.4-year-old. And we can see this is from 1993 to 2023. And we can see the age actually increasing also. So possibility is our medical treatment is better, and everyone is more aware. And you can see for non-citizen actually live longer than the Malaysian, okay? But however, the Chinese, okay, female Chinese, 80-year-old, Malay female 76.4-year-old, other female Putra 75.9-year-old, Indian lady 75.9-year-old, Chinese male 74.4, Malay male 71.5, other Putra male 71.4, and Indian male 76.7. Okay, if you ask me why the Indian, they actually have a lower life expectation, possibility because of the they actually have a very high rate in obesity. Okay, because because you can see just now we see the slide, currently the oldest people in the Malaysia actually is an Indian. Yeah, so that's why the genetic actually do not so much work, right? Because all of them are Indian. If genetic, then meaning that she couldn't be the oldest person. Okay, but however, lifestyle can make a difference. Okay, so you can see what she do. She watch on the diet, and she also consume herbs, and she practice fasting once a week. Actually, fasting is very good. Okay, let's say if you do not have any gastric problem, you are not on any medication, you can actually practice once in a week fasting. Because when or some people actually do intermittent fasting, because when you are fasting, the body there's a process called autophagy. Okay, so autophagy is quite high panda, but actually what it means that you will actually use up all the dead cell. Okay, they will use up all the substance from the dead cell to make use up the nutrient. So meaning that you can clear out the toxin from the body. Okay, so that's why actually fasting is very good if you are able to do so. For me, I cannot because I have very bad gastric problem. Because during last time work in hospital, didn't eat properly. Okay, and the physical activity, she plant her own vegetable and attend her chicken. Wow, so organic vegetable, organic chicken. So that's why it's very good. And actually, she's a she work in the rubber plantation. Yeah, it's a rubber tapper. So she actually when she's fit, she's still actually doing her job. Okay, and this study from Lancet, okay, it said that the gene is very important. Okay, because some people actually inherit the gene. Okay, no matter what they eat, their cholesterol will be normal. I have seen a few of them. It's like this. Okay, and they have gene like they will not easily get inflammation. Okay, will not so easily to get all this connective tissue disease. Okay, and obviously they also have some gene that actually it can help to reduce all the diseases. Okay, but obviously gene is not the important, because we can see just now the Indian lady, she can live so long. Why? Because her lifestyle is very good. So we are able to do the changes, okay, the expression of the gene, which is called epigenetic. Okay, our lifestyle, our environment is going to turn on or turn off the gene. Okay, so our lifestyle is good, our environment good, we are going to turn the gene and they can perform well. But if let's say our lifestyle is not good, they are going to turn on the bad gene, okay, and then turn off the good gene. Then we are going to get cancer or whatever problem. Okay, and environment due to like pollution and also the available of the medical care, or maybe the vegetable and fruits or food availability. Okay, like in Japan, most of them actually they don't eat so much Western food. Okay, but however, you can see Malaysia, the McDonald's, KFC is mushrooming up. But I'm glad that now they actually ban the McDonald's, right? Actually, it's quite good also. Okay, and social economy well-being. If you actually have more money, then you are able to get better this medical care. Because in Malaysia, if you don't have money, need to go government hospital, well, really need to be patient. Have to wait so long. Every time I go, at least wait for 2 or 3 hours. Okay, and the lifestyle, diet is very important, physical activity and active brain. So obviously, we need to train our brain. Because if you have dementia and you live long, actually it's quite troublesome as well. So that's why we need to do the brain training. Okay, you can play Sudoku or any kind of interesting games. Okay, mahjong can but don't be gambling Okay, and then also like you can actually I think best is to play with your grandchildren. Okay, the grandchildren, they like to throw ball, right? Every time I play with my niece, I will throw the ball to them and then I try to catch. Actually, it seems like this is a very good training skill, because actually the best exercise for the brain is to train the response. Okay, meaning that if you're able to catch this ball, meaning you are able to respond well with your action. So actually it's good, okay, to play with the children, because so that you can train yourself as well. Okay, and social connection, just now we covered already. Okay, actually why we actually show the video of Loma Linda, basically I'm also Adventist. So I will prefer to preach whatever I believe. Yeah, because there are many Blue Zone, they have a different kind of this teaching as well. But I'm more confident to teach whatever I believe. So I choose the Adventist health study. If you're interested in other longevity, you can actually Google. Okay, there's a lot of information on the internet. Okay, but I choose what I believe, and then I will tell you. Okay, so if you actually have this 5, okay, you actually can live and have this 5 lifestyle, you can live 10 years longer, okay, than other people. Okay, so first one is plant-based diet, no smoking. Obviously, this one everyone know already, so I don't cover that. And then try to eat more nuts more frequently, 5 or more times per week. Okay, and maintain a good BMI and regular physical activity. So why plant-based is good? Okay, so basically lower down most of the diseases. Okay, for basically why they can lower down all these diseases, because they are very high in antioxidant. Okay, and they are very high in anti-inflammatory diet as well. Okay, and it can lower down the LDL, bad cholesterol, and they can slightly lower the prevalence of hypertension, reduce the prevalence of overweight and obesity. However, it's equivocal for stroke. okay, most likely is related to B12 deficiency. So let's say if you are a vegan, there's very high chance of getting a B12 deficiency. So let's say if you plan to change your diet to B12 to vegan, you need to monitor your B12. Let's say if not enough, you need to supplement. So the B12 actually can be stored in the liver from 2 to 5 years. So meaning that if you change to vegan, you need to do yearly B12. Okay. Otherwise, maybe if you want, you can do some supplementation. Okay, or you can eat those B12 fortified food, okay, like soy meal or nutrition yeast. Okay, basically B12 is actually made from the microorganism from the gut. So that's why all animal-based, they will contain B12, but plant-based don't have. But obviously you also have organism also lah, but sometimes it might not be able to produce enough. So that's why you need to check. So let's say if we have B12 deficiency, what we will get? We will get something called megaloblastic anemia, meaning that your red blood cell will be big, okay, and you will get low in the red blood cell, and it can also affect the nerve because B12 is required in the new cell develop. Okay, so that's why it's very important to have adequate level of B12. Okay, but for cancer, it seems like there's a lower risk in vegetarian, but for individual cancer site are inconclusive. Okay, so basically why I want to show this because I think a very common problem is osteoarthritis, right, for aging community. But actually, I also have osteoarthritis. Okay, because last time I went to Penang Hill and I didn't walk properly. I didn't do enough warm out and actually I injured my knee. So sometimes my knee will pain as well. Okay, and very important is the omega-3 because omega-3 is the anti-inflammatory. Okay, you have a anti-inflammatory properties. So a lot of time, what do you eat for omega-3? Salmon, right? Okay, but you see here, they say higher okay, if you have a whole food plant-based diet, the serum level of omega-3 is higher than omnivores and even higher in the fish eater. Okay, so if you eat whole food plant-based diet, you will have enough omega-3. Okay, but let's say if you are vegetarian, but you're not eating whole food, I cannot guarantee lah. But if you whole food plant-based, you'll get enough. Okay, because the metabolism of ALA actually for animal they have more in DHA and EPA. Okay, and because it's found in abundance in legume, vegetable, soy. Okay, they can produce anti-inflammatory prostaglandin, so it can actually reduce the inflammation. So why the joint is painful? Because there's inflammation. Why there's inflammation? Because we overuse the joint. Okay, so we actually got injured. So our body try to recover, okay, replenish it. But however, if the body do not have all this inflammatory substance to calm down the inflammation, it will continue. Okay, so that's why you have bone spur. Okay, and also sometimes you maybe you will lose the gel as well due to aging. Okay, and the animal protein consumption will increase the permeability in the stomach, small intestine. And this animal protein, when it goes to the body, it will actually cause the immune complex to develop in the body. So meaning that your immune system become haywire. Okay, and then they will cause more inflammation in the body. So that's why if we change the animal protein to plant protein, we will able to reduce the inflammation dramatically. Okay, because animal product is it will actually increase the inflammation in our body and also all the processed food. Okay, and obviously low fat diet, low fat, high fiber, whole food plant-based diet can help us to reduce our body weight. Because if you are excessive 1 kilo of body weight, it will cost 5 kilo to the knee. So let's say if you excessive 10 kilo, too much, okay, then it will cost 50 kilo to the knee. So imagine the friction there. That's why when you actually go down the hill or when you go down the stairs, it will cause more pain because your body weight is pressing the knee. So this is the chart, okay, from the mindful data. So you can see here say that if you take flaxseed per ounce, I think per ounce it will be like 3 tablespoons. If you take 3 tablespoons, it will be 405 of the adequate intake, okay, of ALA. So actually, you just take 1 tablespoon is more than enough. Okay, so obviously I don't ask you to every day to take flaxseed, but you can actually with chia seed or walnut, you can actually turn around. Okay, so all the nuts and seeds, they actually very high in omega. You no need to buy the fish oil supplement. Okay, why you want to spend money to buy the supplement? Better you spend the money to buy all this whole food, right? Actually, they consider flaxseed and chia seed superfood. because it can help you to bring down your sugar level, can bring down your cholesterol level, can bring down your blood pressure. All this is scientifically proven already. Why no people tell you? Because they want you to buy the supplement. So no one tell you. So I'm telling you because I don't sell supplement. Okay. Then that's why it's very important to eat whole food plant-based diet that actually can reduce the inflammation. Okay, you can see, obviously this is by serving size. Let's say if you eat bigger salmon fish, maybe the omega-3 will be higher than flaxseed. But however, 1 tablespoon is more than enough for your body. And last time, whenever I have knee pain, okay, I will actually take flaxseed oil. Okay, because the omega-3 is even much more higher if you take the oil. And I just take 1 tablespoon a day, okay, with my diet. And then the pain actually go away very quickly because it's very high antioxidant. And then I tell my friend also try. Also, the knee pain actually go very fast. Okay, but however, I don't suggest to take long-term flaxseed oil. Because I saw some of my health guests, they took like 2 tablespoons a day every day, and their HDL level is a bit lower. So I think too much is not good. And then if you have variety, it's good. Okay. So maybe you can use like flaxseed oil, olive oil, like you can alternate or whatever. Okay. Because I think variety is important and you're able to get nutrient from different kind of diet. Okay. And also the role of exercise capacity in the health and longevity of for the centenarians, for those who live more than 100-year old. So that's why they found out that the physical activity have the highest positive influence for chronic diseases. And when we age, okay, they will decline the lung function because the muscle maybe become a bit weak. I think the first health talk we talk about sarcopenia, right? Okay, the physiological losing of the muscle, involuntary muscle loss. Okay, it can happen to the muscle in the lung, in the rib case as well. So your lung cannot expand too well if you do not do any exercise. So that's why it's very important to do deep breathing exercise as well. Okay, and when you do exercise, it can improve your lung function as well. Okay, and the age-related decrease in limb mass is greater in the lower limb. Okay, so when you age, okay, for the centenarian, they are going to lose more, okay, the muscle in the leg, okay, compared to the upper limb. And just now you see the Loma Linda video, right? A lot of them are sitting on the wheelchair. So let's say if you don't do exercise, then when you become older, then maybe you need to sit in a wheelchair as well. Okay, so that's why it's very important to do exercise. And actually, this picture is given by one of my health guests as well. Okay, basically, she had very bad knee osteoarthritis, very painful, every day very pain, and need to take painkiller. And the doctor advised her, okay, to do operation, but she actually not very keen to. And she get this picture from the physiotherapist, and she very sincerely do every day, okay, every day. Each picture she do 10 times, okay, and 10 times in a row, and she do three rounds. Okay, after she sincerely do, after 1 year, actually during she's doing, the pain actually reduced, and after 1 year pain free. So she's decided not to do operation. So what is the logic behind on this exercise? Basically, you can see all this exercise is basically to train your muscle in the leg, in the thigh. Okay, so it's very easy. Okay, let's say this one, you just sit down and then you just raise your feet and then you try to you make sure this feet is holding up, okay, and you hold it, okay, for 10 count, and you sit down again, to bend down the feet again, and you try to do again. Okay, so this left leg 10 times, right leg 10 times, and then after that both the leg for 10 times as well. Okay, so if you have time, actually, if you really have a knee problem, you can do all this. Okay, so for WHO recommendation of exercise is 150 to 300 minutes, so around 30 to 1 hour exercise. Okay, moderate intensity every week. Okay, and also muscle strengthening exercise 2 or more days in a week. So muscle training exercise, you can actually do either you can use a weight. Let's say you don't have a weight, you can actually use a water bottle, okay, to do all the exercise, or you can use your own body weight, okay, like plank or maybe this sit down and standing up. Okay, you sit down and you stand up for 10 times. It also can help you. And just need to take note, if you want to do squatting, you make sure your knee is not beyond your toes, because that is, if you go beyond that, it's going to injure your knee as well. So if you want to do squat, you have to be careful. Okay. And let's say you never do exercise before, you need to go slow. Okay. So maybe you just do like 2 or 3 rounds. Okay. 2 or 3 times only. You don't go like 5 or 10 immediately. So you start slow and go slow. And let's say if you have a very severe, like those heart problem patient, maybe you have to consult a doctor and see what the advice they give you. Okay. And basically, we need to, for the person who are more than 65-year-old, they actually need to train the balance. Okay, balance, there are a few things. Okay, you can stand on the one leg. So let's say if you swing like this, meaning that your flexibility is not, the stability is not good. Why this is important? Because if you do not have this balancing proper, you are not good in balancing, it's very high chance for you to fall down. Okay, so that's why a lot of people, they tend to fall because they lost of the balancing skill. Okay, that's part of aging as well. But sometimes my mom will tell me, "Ayo, I age, I cannot do anything." But actually, if you train it, it can become better. Even balancing as well. If you start training it, then it become better, because our brains like that. If you don't use them, then it become age. But if you use them, they are able to grow even better. Okay, they are going to do branching. Okay, that is called. And now we are going to talk about the benefit of nuts. And actually, it's a very good source of protein. It contains unsaturated fat and monounsaturated fat. Okay, so they can help to lower down the bad cholesterol. And just now we saw the walnut is very high in omega-3 fatty acid and very rich in fiber. Okay, it contains plant sterol. Plant sterol actually have a same same chemistry properties, okay, with the cholesterol. So when you eat the nuts with all the cholesterol food, okay, they are going to absorb the nuts plant sterol first rather than the cholesterol. So they will lower down the cholesterol absorption. Okay, L-arginine basically is an amino acid. It can help to lower down the blood pressure and also improve the cholesterol and improve overall blood vessel health. Okay, so this one actually look very complicated, but I like it because there's a lot, they tell you why nuts is good. So basically, they have unsaturated fatty acid. It can reduce the bad cholesterol and reduce the triglyceride. They actually contain a lot of fiber, so it can bring down the blood sugar and also reduce the cholesterol absorption. They have very good high in mineral. It can help you for the sugar control, and it can help to reduce the blood pressure, because actually the culprit of hypertension is the sodium. Okay, so anything which is very rich in other mineral like potassium, magnesium, calcium, they are able to counterfeit the effect of sodium. Okay, and arginine can also help to reduce the blood pressure and endothelial function. Polyphenol, it can help to reduce the platelet aggregation. Okay, tocopherol basically is actually the composition is actually is also similar to vitamin E. Okay, so that's why vitamin E is very good antioxidant. So it can reduce the oxidation and inflammation. Okay. Okay, another one I just want to. Nowadays, a lot of people like to skip meal and don't eat breakfast. Okay, and very short meal interval. So that's why actually here suggest that it's best to have 3 meals. Okay, and then try to have the interval more than 4.5 hours. Okay, or 5 hours will be better. And then it can actually reduce the mortality. And the regional attendance and longevity is also important. So any kind of religious meeting, if you're able to attend more than once a week, it can reduce the mortality by 33%. Okay, so so hopefully you can remember what we have run through today. So social connectedness is very important, social relationship. Okay, so basically actually we are Adventists. So basically the writing, actually most of them is from the Council of Diet, like the Loma Linda. Actually how they know all this health practice even before the study came, they actually follow this Council on Diet, which is written by E.G. White. So you can get free from this E.G. White writing. So if you're interested, you can download the apps. And some people actually ask me where I work. So I'm working in Anan Healthcare. and it's actually it's in the jungle. Okay, and there's a lot of rocks around there, so a lot of people like to come for urban escape. Okay, but anyway, we are teaching the healthy lifestyle and help people to change their lifestyle. We have a 5 day, 10 days, 20 days program. Okay, so this is the monkey I took, and this is the sunrise. Yeah, so actually it's quite nice. Every day is like holiday for me. Okay. Okay, so today my presentation, before I end, I actually will want to just to clarify. Yesterday, some people asked about the radiation. So yesterday my mind is a bit cloudy, so I didn't explain well. So basically, only the X-ray and gamma rays is scientifically proven that it can increase risk for cancer. But however, all others in green area, which is occur in natural or except ultraviolet light, obviously you know, too much sun exposure, it can cause skin cancer. But all other visible light, infrared or microwave or radio wave actually do not have much studies say that they can cause cancer. Okay.